turned it on.
Okay. Our audio good? Okay. Well, good morning to everybody here on the West Coast and on the East Coast. Good early afternoon. Thank you for joining us. We have been on a short, extended time off the last 2 weeks. Doctor was taking some vacation, and we were doing some improvements all around the office here. We can't wait to share those with you. And we've been doing some exciting stuff. So this is our weekly live question and answer series where we look for questions from you in the audience. I'll ask the doctor those questions, and you can do that a couple of different ways. There's a chat section over to this side in YouTube. If you're logged into YouTube, you can post your questions there in the chat section. I'm watching for those, monitoring those. I'll ask the doctor. You can ask us anything and everything health related, and we'll just off the cuff give you our best answer. Dr. Althorpe is an integrative functional physician with many, many years practicing standard emergency healthcare, urgent care, and went on to focus on nutrition and wellness and prevention of disease. So we will approach your questions from that perspective. And just a quick disclaimer, of course, this is not meant to be specific medical advice for you. This is general information on how we would tackle a question here in the office with the patient. For specific medical advice, do be sure to follow up with your physician and ask those questions. You can, of course, book an appointment here with us here at the office at Tustin Longevity Center. We are accepting appointments in person and via telehealth. You can also email your questions into us if for some reason you can't get logged into YouTube. And our email address is office@tlcdoctors.com. That's office@tlcdoctors.com. Put somewhere in the subject line, question for YouTube, Q&A, just something like a keyword like that so that the question will be routed to us and we can ask your questions on the following week. We're here every Wednesday at 9:45 a.m. And again, thanks for joining us. Dr. Althorpe, thank you for your time.
Thank you for joining, and I missed the last 2 weeks, but had some much needed rest.
Yes, we actually didn't let her come in so that we could do some things in and around her office and give her some much needed time off. So, all right, Dr. Well, you ready to dive in?
Sure.
Okay,
Sure.
Okay. It's been about 2 weeks and we have a couple questions here. The first one I have was emailed into us by Katie. Katie asked, my sister's 2-year-old son has severe allergies. He is allergic to the top allergens, wheat, soy, nuts, dairy, etc., and more. What recommendations do you have to approach treating these allergies?
Well, in general, the avoidance of the known tested items should be strived for. However, the food system is rather corrupt. And if you're depending on labels and stuff and buying packaged or processed foods, it's very likely that you're getting derivatives of wheat or grains and soy and corn and such in the diet. So I would say you would have to make all his food yourself, that you would try to use only organic sources, and that an elimination diet would be the approach. Now, I don't treat as young as 2-year-olds. I generally start seeing patients here around the age of 5 and older. So you should be, of course, following your pediatrician's guidance here. And there's many questions as to, does he have asthma? Does he not have asthma? Does he have eczema? Does he just have seasonal allergies? What is his blood type? What is his general health? What is the family health? And the genetics of the parents as well. And we would be asking an elimination diet where you would start out with something very, very basic for like 4 or 5 days, where you would give him just a protein and maybe one vegetable. And if he seems to tolerate that well for his 3 meals and no snacking, and then his drink should just be water, not milk or juices, okay? So in other words, you're trying to narrow his exposure down greatly through food, because so much comes through the oral environment to your immune system, and 80% of it is living in this region here. And then if he tolerates that well, then you can add in a second protein and a second vegetable for 4 days, and then a third protein and a third vegetable, and slowly expand it in this fashion.
Right.
The condiments that you could use would be butter or ghee. I would only cook his meat or chicken or fish or pork or crustaceans like shrimp or lobster or crab. I would only cook in butter or coconut oil, beef tallow, or suet, okay, which are saturated fats. Because cooking in vegetable oils is allergenic, okay, even avocado oil, all right, olive oil. So, in other words, you're starting with a very small exposure menu for 4 days. And the child might be fussy and addicted to maybe treats and things, but you have to work with a narrow menu. And you need about 4 days for the immune system to calm down. Those are just the basic facts. Then you expand it in the next 4 days with a different protein and vegetable. And the other condiments, salt, pepper, ghee or butter, and leave it at that. And that's how we would approach it. Now we would do testing. This typical allopathic pediatric approach is probably doing the skin tests.
Right.
There is a serum test for IgE, which is the immediate anaphylactic reactions, but we do it for the IgG, which is the chronic reactivity. And then, of course, we would get his blood type. And then we would probably do a stool analysis to look at
leaky gut.
Yeah, leaky gut issues and so forth. But that's how you have to approach it, and that's how we all have to live our lives trying to cook at home. We've been trained through marketing to convenience, buy outside, package, process, even going to restaurants. Unless you demand of your restaurant, and it'll be a higher end, that they don't cook in vegetable oil or seed oils. You really, even if you just get our carnivore diet and you're getting a steak, they could be cooking it in a seed oil, you know. So it's a challenge, but that's what I do. I almost never go out, and if I go out, I'll just have a steak or something like that, and a vegetable like broccoli or Brussels sprouts or something. I try not to go way beyond unless it's a real seasonal holiday.
So a couple of thoughts I have or comments. You mentioned that you don't normally see a 2-year-old, and I would say your cutoff is, although you do see some children from time to time that are in the 6, 7, 8-year-old when they're coming with their parent, you typically are seeing adults ages 18 and older. That's what your focus is. We do have some doctors here, like Dr. Kaur and Priya Patel, that are they deal more with children more regularly, and certainly with a pediatrician on board, they can help guide it from a nutrition and comprehensive perspective.
There's nutrients that might be approached as well. We have a gut type of repair system.
Yes.
The lining of the gut is one cell membrane thick.
Right.
It is a bilipid membrane, phospholipid, fats, and protein.
And if that's irritated, inflamed, damaged, that's certainly going to show up as food allergies.
Right, and allergies in general. So there could be all kinds of little inflammatory cuts, you might say, from the defensive proteins that are on vegetables and fruit, which are called lectins to repel insects and fungus and so forth.
Right.
But if you're eating it, that doesn't mean it's not going to injure your gut.
Right.
Okay, and this is getting more problematic with all their genetic modifications and so forth. So we use a phospholipid powder called NT powder, and then we use a protein support called SBI Protect powder. We make a little mixture of this, and we'll give that to them in a drink morning and evening, and that could be a very good first step for the child.
Of course, we don't know from the question if we're talking about acute, severe allergies, or if these are more chronic, low-grade IgE versus IgG. And then we have some therapies here and some testing. We do allergy testing here, both serum and skin.
And skin.
And then we have the sublingual immunotherapy drops that help the body identify and calm down to those as well.
Yes, yeah, those are allergy end drops. That's homeopathy, where like cures like, but it's in parts per billion ratio. So we do all these things, but we look at it from a more total approach. But we're there to help work with you to try and teach you about your eating, your cooking at home, and what you're doing. Now, of course, mom and dad and brothers and sisters, if they're eating poorly, and you're trying to restrict this poor 2-year-old, he's not going to understand, is he being punished or something? So the whole family will have to adopt a rotation diet, which I recommend. I basically live a rotation diet lifestyle where I'm on a very basic protein, vegetable for my 1 meal or 2 meals a day.
Right.
Yeah.
Okay. If you had to take a guess, what blood type would you think this 2-year-old is?
I would say A type blood, because when you don't digest well, and A's as a class of people have a tendency not to break down their fats and proteins as well.
Right.
That makes the presentation of these materials for the body to evaluate and absorb or not more problematic, and the immune system becomes heightened. Hence allergies and many other symptomologies as well. So it could be a little apple cider vinegar or digestive enzyme support.
Perhaps some GlutatShield.
Yeah, would be helpful. But there's so many questions, but that's kind of a ballpark idea. This is something not unfamiliar to us. I just prefer trying to see older people who can then raise their children. So hopefully if I get an 18-year-old, they'll learn how to live well. I just had a young lady who I saw since she was about 8 years old, and she was a little, she's from Japan ethnically, but born in America, and she made me these beautiful little origami fold-outs, and she had her little kimono on and everything, her formal dress. What a lovely girl. But she had bad eczema, terrible eczema around, and it was, for dating and all this kind of stuff. When she became a teenager, eczema everywhere. We got rid of it all, and her mother and father were just thrilled, because it didn't work with whatever she was doing with the pediatrician. Then, of course, she goes to college, and then at college she starts eating poorly. She's out of her and then all this eczema comes back. So then she gets back on a few of these things, these NT powder and the SBI Protect, and she did better. But again, life and stressors, she falls off. Well, I just saw her again, and she got fully back on it, and within a few weeks, her skin was very, very nice looking again. So I've seen it over and over again. If you train up a family and a child in the way they should go, when they grow old, they will not depart from it. That's a paraphrase of a verse in the Bible.
It's a good example of how we're accustomed to going to see a specialist when we have a problem like a skin issue. Let's say go to see a dermatologist. They'll probably put you on a topical steroid and maybe try a few different types or kinds. And then if that doesn't work, it's sort of like we shrug our shoulders, maybe go see an allergist, and you get bounced around from specialist to specialist, versus a well-rounded physician, maybe a general practitioner, a family medicine physician, certainly one that understands the body and its systems, how they interplay, because you don't think necessarily skin issue gut. That connection isn't obvious, unfortunately, to most physicians, but I think that's why the doctors here have been so successful, because they've taken the responsibility to have a multidisciplinary approach. Okay, great question. Allergy is a very complex issue, but hope that information is helpful. All right, I do want to mention it appears that we're having some video stuttering issues on YouTube. We were seeing that before we went live. We decided to go live anyways. I think the audio is working out fine, so I hope it's not too much trouble for you all. Okay, I have a question from Elizabeth, who asks, if you decide to take the COVID vaccine, which one is the safest? Also, would chelation IV therapy be good to do after taking the vaccine?
Well, that's a loaded question. Which one would I do? Again, because your age, let's say, unless you're with severe comorbidities, you're elderly, say past the age of 70, and you're at health risk. Anyone younger and taking care of themselves. I'm almost 70 and I have no medical problems, no joint problems. I just have allergies. Okay, I would not take it because my risk of having a poor outcome from COVID is 99.95%, something like that, right? And if you're a younger person, it's 99.98 or 99. So I would then, with great caution, consider why are you taking this? Now, there are a multitude of well and learned experts in virology, immunology, pulmonology, intensive care specialists on both sides discussing this, and there are many alerts going out from the more conservative side suggesting that we don't know enough and there is too much risk when your inherent risk is so minimal at your age. Why take the risk? And then they'll make the argument there is no established credible proof reproducible that there's asymptomatic spread. So they reject that you put upon a healthy person without any symptoms that they're spreading disease just by talking like you and I are.
Right.
So which one would I choose? I would recommend that you see your doctor, consider your risks. If you're very elderly and you have multiple comorbidities, that might be a reason for you to take a vaccination. But in the light of, in the past, since around mid-December to January, February, March, in the past 90 days, we have had almost 45% of all deaths due to association with vaccinations. All deaths have been as many as there has been since the past 10 years. So in 3 months, we've had more vaccine-associated deaths reported through the VAERS system than we've ever had reported in the past 10
I'm
years.
curious, you said VAERS, that's your source on this? What's
Yeah.
VAERS?
VAERS is the Vaccine-Associated Event Reporting System.
Okay. VAERS.
VAERS. So I took an oath, do no harm. There are alternatives. You can take good care of your immune system. You can drink plenty of water, get a good night's sleep, do modest movement and exercise. Don't eat a high carb, immune suppressing, sugary, immune suppressing diet. Don't eat late at night. And take vitamin D, take zinc, and take vitamin C, and do as we've done for the past 40 years of my practice in medicine. Every flu season, if you're having symptoms of a cough, aches and fever and malaise, stay home and until you get better. Don't come to work with that or to school with that. Otherwise, just practice your normal healthy lifestyle. Then we have such things as ivermectin, which are used for preventatively, and we have hydroxychloroquine. And so in the light of all these options, and I have spent tons and dozens of hours every week, and I'm on top of this. I have yesterday's CDC and FDA statement on the Johnson & Johnson suspension for the Johnson & Johnson vaccine. I'm up on this. There is really a very good, credible argument to be made that, I have had some of my videos taken down. if we can't discuss these things, if science is always challengeable,
Right.
you should be able to reproduce, present your data. Another physician scientist should be able to reproduce what you've done and validate your work. So I cannot recommend something when I see the vast majority and all my patients have done well. Every one here of our thousands and thousands over the past year plus have done very, very well. We're seeing such a decline in the death rate and the case rate. And in the states that have been open, there's about 17 now that have moved toward opening. And we've had many large people events. We don't see in these states the spiking. So I'm going to say, trust your immune system, take care of yourself, consult with your physician, and if you are at high risk, which you can share with your physician as to which one might be better for you, and go from there. But I can't support something with as much concern at this time.
Great. And just the tail end of her question about chelation, let's say you got this vaccine or another vaccine, do you recommend following up with chelation therapy?
EDTA chelation therapy does so many things because it opens up the microcirculation, and one of the chief concerns of late emerging in the past 3 months from all these vaccinations is microcoagulation. And now the cerebral venous thrombosis,
right.
Thrombosis that is emerging with the Johnson &
We saw that with
Johnson
the AstraZeneca vaccine as well.
and AstraZeneca. Now those are both DNA vaccines that are using the adenovirus as a carrier delivery system of their genetic therapies that they're calling vaccinations. Many are arguing, is this really a vaccine? It really is more of a medical therapeutic or gene therapy rather than a vaccine. There's too many questions. There's too many very good, credible scientists saying pause, hold off, wait, and then. But with all these circulation issues, EDTA chelation is the enhancer of improved circulation. So I would absolutely chelate. I do it preventatively anyway.
Right,
It's
right.
like living a preventative lifestyle. And all those patients who have had, thromboischemic events for cardiacs that do this, we see improvement on the Tech Trial 1. We saw the people who had in Tech Trial 2 trial to assess chelation therapy for the vascular perfusion. We saw reperfusion of their ischemic limbs from diabetes and other things like this. So that there's no doubt EDTA chelation therapy is enhancing not only to the microcirculation, but in the bigger vasculature as well.
Great. Okay, next question. I want to purchase a nebulizer after watching a Dr. Mercola interview concerning hydrogen peroxide and saline solution. Also, what is food grade hydrogen peroxide and what saline solution? So I'm not sure what the question there is. Are you familiar with a nebulizing saline hydrogen peroxide solution?
Yes, I'm familiar with ozone or oxygen therapies. Saline is just a isotonic, meaning salt water solution that's compatible with your membrane salt level. Okay, every cell has, your plasma has a number of ions in that salt, and so water with salt in it is called saline solution. So if you put in food grade, which is 3% hydrogen peroxide in oxide, okay, and then you put that in a nebulizer and you inhale it, you are presenting oxidative stress to the respiratory and sinus membranes, and this may have an advantage. Now, I know of no clinical trials. I mean, this is the number of studies that I've gone over just in the past 2 weeks. About every week I have a pile that thick, so I'm reading all the time. but I don't know of any on.
You can't recommend this per se because you haven't seen any research on this.
Right, and I haven't seen any long-term value from it. I know of the intravenous hydrogen peroxide,
Yes.
which we can do here and have done here. Ozone, ultraviolet radiation of the blood. What I do is I use the Argentin silver, which is the
Silver
nano.
hydrosol.
Yeah, it's a nano hydrosol is a very tiny particulate silver. Silver is a natural antifungal, antibacterial, antiviral agent. And every day I begin work, I squirt up my nose this so that if a patient comes in my office here and there is a viral particle floating, because every day I listen to a patient, I walk in front of them after I tell them to take a deep breath, and I walk to the other side and listen to their other side of the lung. So for 40 years, I walk every day in the close pathway of people breathing out, okay?
Right.
So I'm healthy, I'm almost 70, I've worked 40 years, never really get sick ever. And I inhale this little squirt up my nose of the Argentin silver. And then I will often, as a spray, even if I feel a little tickle or something coming on, they have a mist form of this. So I will spray it, and I will just spray towards my nose, and I'll take a deep breath as I'm doing it. And I think that is superior, safe. You can overdo with oxidative therapies. Yes. So there's a balance, and because I'm not familiar, Dr. Mercola has a long history of experience and wisdom himself, so I'm not going to endorse a inhaler of normal saline with 3% food grade hydrogen peroxide because I just don't think it's necessary. I'd rather you do a inhaler that uses no risk for cell membrane. Oxygen can be a oxidative damage hit to the membrane.
Right. Okay. Great answers. Folks, we are just about out of time for this week. I am going to make sure that we capture the questions that we did not have time to get to, and we will, in the very least, start with those questions next Wednesday. But I want to let you know, if you're not already subscribed to this channel, go ahead and do so. You can do that by clicking, I believe it's a little bell icon, or there's a subscribe button there. Because we are looking at other formats, we're looking at hosting some videos on our website where we can have more time with you, be a little bit more liberal with the questions that we answer and recommendations that we propose. So to stay up to date, to make sure that you catch anything that we do, make sure you subscribe. And if you're finding value from these videos, from this content, tell your friends, tell your family. We don't charge for this, of course. The fee that we ask is if you find value, tell somebody about it. And liking the video lets us know that we're connecting with you as well too. And you can leave your comments under any of the videos that you watch. If it's an older video and it brings up a question for you, we do look for those comments as well too. Thanks again for joining us, Dr. Ellithorpe.
I really enjoyed doing this, and I am looking forward to the evening, and I think I'll do it bi-weekly, and maybe do a 45-minute.
Right.
And I might just do it from my home or my office after work here, and just have fun staying in contact with my patients.
Yeah, we've been talking about this for some time, but a lot goes into these productions, and we're getting a room that's going to be dedicated for this. We're upgrading some of our equipment and technology so that we can do this quicker, better, faster, produce more, and have a higher quality for you all as well too. Thank you so much. Thank you for joining us. We really appreciate the questions that you put out there, and I just want to let you know we care about you, and we hope that this information is helpful for you and your loved ones. Look forward to seeing you next Wednesday here on YouTube at 9:45 a.m. Pacific. Until then, be well.